core breathing. What I mean by core breathing is breathing from your belly, which is the proper way to breathe. We breathe from our chest. Like, if you've ever taken a yoga class and the instructor says, take a big deep breath, what do? Your ribs flare, your shoulders go up, and your chest fills with air, right? That's a big deep breath. That's what that means to us right now. What if I told you that that was backwards? And when I say take a deep breath, I mean fill your belly. My chest and shoulders didn't move, just my belly. And then when we exhale, our core wraps and does what it's supposed to do, and it works. So throughout the day when you're chest breathing, everything up here is lifting, my core is not engaged. So you tend to have bad posture. We're kind of leaning forward, we've got a pelvic tilt, either forward or backwards. You're sitting in a desk chair, you're slumped over, shoulders are rolling. We're just not sitting properly, and we don't function like we should properly. So proper core breathing means that your diaphragm is doing what it's supposed to do. Your diaphragm is like this, and when it works, it pushes down like this, and then it comes back up, down, up, down, up. So it makes sense to breathe from your belly because you're pushing everything down. When it works properly, your abs are doing this daily, all day long, 20,000 times a day, every time you're breathing. They're constantly working when you're thinking about breathing from your core. So if you think about it that way, you don't really need to do abs because your abs are active. They're constantly working. And when your abs are working properly, so is your pelvic floor. Your pelvic floor should contract and come back and contract and come back. When you're doing Kegels, they're great. Kegels are awesome. However, the problem with Kegels is you generally don't really know how to release your pelvic floor. If your pelvic floor is overactive, it can cause just as many problems as it can being underactive. So you really need to learn how to stabilize and how to control those muscles again. So you're gonna have to get really connected and really in touch with your body again, because you may have lost some of that connection. If you have diastasis recti, you have lost that connection. Your pelvic floor is probably weak, your abdominal wall is definitely weak, and that could be causing all kinds of problems in your pelvis, in your hips, in your back, chronic low back pain, problems with your abs whenever you do exercises, you're feeling a lot of pain, like instead of a soreness, it's an actual pain. All of these things are symptoms of diastasis recti. Even constipation and bladder incontinence are also symptoms of diastasis recti. All of those things can be remedied by learning how to breathe properly and learning how to use your pelvic floor and your core the way they were supposed to do. So we're gonna practice this right now. I'm gonna teach you the core breathing technique, and I want you to really think about this throughout the day. It may take you a few days to get used to it, to be honest, or you may need to stop during an exercise and think, oh, I forgot to breathe from my belly, I'm doing this wrong. So you're gonna have to really think about it, establish a mind-muscle connection, but here's what we're gonna do. I want you to turn to the side, good posture, shoulders are back, chest is high. We're not slumping over, we want everything to be in alignment, in a good, solid place. So when we breathe, instead of up, when you inhale, I want you to push out with your belly. Think about filling up your belly with air. It may be difficult for you to do the first few times. You may not get a full belly of air. As you practice this, your body will reset and get used to doing these motions, because this is the proper way you're supposed to breathe. So when we take a big deep breath, the belly expands. When we exhale, I want you to pull your core in. I don't want you to actually suck in. I want your core to do the work. And your pelvic floor should be coming up as well. We're breathing out, fill in the belly, the pelvic floor releases. Exhale, everything comes up. In, we're going out. Exhale, everything comes in. So essentially it's backwards if you think about it. When you think about breathing from your chest, when you take a big deep breath, the chest rises, everything kind of goes the opposite way. We are flipping that. So when you inhale, we're pushing out from the belly. When we exhale, everything draws in properly. So my abs are working here. Everything is working properly. Transverse, my rectus abdominis, my obliques, everything is firing just from breathing. So when you think about that, it's pretty amazing that you can change your entire core just by changing the way you breathe. So in, fill the belly, out, in, out, in, out. Make sure your posture's straight. Now you can keep doing this throughout the day. This is really gonna change the way that your abs respond to exercise because they're going to learn how to contract and release on their own. It's gonna fix the issues with your pelvic floor. It's gonna hopefully help closing that gap to your diastasis recti. There are a lot of exercises that you can do to close that gap. A lot of exercises you need to avoid. We're not gonna get into that today. What I want you to focus on though is breathing. This is the basics, this is the foundation, this is something you need to know and you have to be working on. You need to master the skill if you want a strong core. Because if you don't, it's not gonna work properly and you're still gonna have all of those issues, even though externally you may see a little bit of change. If the change doesn't happen internally first, you're never gonna see that lasting external change. So change the way you breathe. Think about this breathing technique in everything we do for the next 2 weeks. This is your foundation. This is what you're going to be doing forever.